You're going to go over a really common topic and how we can help save your life potentially is by monitoring blood pressure. Blood pressure is one of the most underlooked at values when it comes to overall health on a daily basis, and you can do it relatively simply. You can buy a blood pressure cuff, you can take it annually, or if you reach out to us, I'll send you a link to a solid blood pressure cuff or provide it in the notes below with the link. And you could get these off Amazon directly to your house, but just know they're not 100% accurate, but they can help get you started at least. And so talking about blood pressure, what does it mean? Blood pressure is the force that blood exerts on the blood vessels. High blood pressure or hypertension is where the force is above normal, and low blood pressure is below normal, and both have issues. So that's why it's important to check on a daily basis. Now, if you have high blood pressure, let's kind of talk about why this is scary overall. It can cause kidney and liver damage. It can cause significant heart damage and atherosclerosis, the number one cause of death in adults. And so as you get older, your blood pressure will probably go up because what's called arterial stiffness, the arteries in your blood, arteries pump blood away from your heart to your organs. So these are things that you want to monitor. Make sure that you take a good look at this. But really what we're looking at is a normal blood pressure is 120/80, but after working cardiac rehab, we would recommend patients under 110/70 if you can. Now, if you have elevated blood pressure, you're going to be 120 or higher on your systolic blood pressure and less than 80 on your diastolic blood pressure. Now, why those numbers matter is because it's the force. Remember, it's force on your arteries and also your heart. And so as you get older, we want to try to objectively achieve these numbers. Now, supplements, things along those lines, we're going to get into additional to a healthy diet and regimen, and exercise. Exercise actually lowers blood pressure and is extremely effective in that when it's cardiovascular exercise, and it's exercise prescription based off your data. So not just going out and exercising, but knowing how hard to exercise, what your heart rate should be. You can look at a lot of data and values, and that's what we take care of for you. But additionally, some things that can help with managing blood pressure is blood pressure, different list of cardiac medications, looking at other factors such as diet. Salt pulls water into your bloodstream, and so that can increase the force of blood because you have a higher blood volume against your arteries. So things that you can do is talk about a lot of different things, but really like exercising specifically with heart rate data, cardiovascular exercise, and resistance training. The second thing is using a diet that's focused on lower sodium for the most part for most people if they're struggling with high blood pressure. But if you're normal blood pressure, that's where what you want to do is continue to maintain a healthy diet, getting in plenty of protein, carbs, and fats, and talking about that with a more specific angle. We talk about all that. When it comes to supplementation, this is the 5% difference, right? Like 95% is that what we just talked about earlier, but really digging into some other data, some things that can help. We are going from a grade list. A is very effective to D or F. And really what we're coming down to is there's several. When we look at like healthy people who have a very balanced diet, they eat a lot of blueberries, very effective. Caffeine has a significant effect on blood pressure and increasing it. So that's something to keep in mind, where we have a small decrease in blood pressure with blueberries or antioxidant based things. Citrulline also has a small decrease. It's found in a lot of like nitric oxide based foods like beets, but also you can find this in like pre-workouts and things along those lines for blood pressure. So the DASH diet is something I kind of mentioned earlier, is like focusing on high fiber foods, whole grains, plenty of protein, low salt. We get into that. But as we go down, these are just some things you guys can kind of scroll through. I wanted to give you access to this. But one big thing that helps with blood pressure is mindfulness. So if you're a more anxious person or have a higher risk of anxiety just from just general life, environment, job, stress, just in general, make sure that you're focusing on stress management as well to help with blood pressure. Meditation. There's an app that I recommend called Waking Up. It's a fantastic app. Literally has daily routines with that. I can give you access for that as well. And then lastly, as we kind of go down here, just some other things that you can do is focus on different dietary strategies, exercise, etc. So when it comes down to the research, cardiovascular function, things along those lines, we want to focus on essentially focusing on your diet, exercise, step count, heart rate data all first. We manage all of that for you, give you a health report and scorecard, and you can take a lot of things away from it. The second thing is if you need to talk to your doctor or cardiologist about medications, we help educate and empower you, and we can send these report cards to them so that they know what you're eating and providing for exercise. Lastly, if you have questions about blood pressure, how to manage that on a daily basis, things along those lines, or just need more help from us, please reach out and let's get on a call for free.